Okay, I think we'll just get started here. So thank you again for attending. My name's David Stewart. I'm the co-founder and CEO of Approov. And I'm the least interesting person you're going to hear in this webinar. So we're going to be talking about enhanced mobile healthcare app and API security. And I'm just going to introduce the two speakers and then let them entertain you for the next 45 minutes or so. We will be answering questions at the end. So if you do have any questions, please enter them in the chat and we'll deal with them when we get to the end. And I'm looking forward to seeing what kind of questions you have. So first of all, I'd like to just talk about the two speakers we have. Tiago Calado is from MV in Brazil. He is the product and development manager there. And I particularly want to thank him for taking the time to attend this webinar and tell us about his experiences, because as we probably all know, things in Brazil are not too great at the moment, and companies like MV are in the front line of doing whatever they can to restore life to something like normal down there. So taking the time to talk to us today is really, really appreciated. And then additionally, we have Skip Hallsmith, one of my colleagues. Skip is one of our principal engineers, and he's one of these very unusual people that is very comfortable with, the front end of the interactions with customers, as well as getting very deep and technical with customers who are actually using our solution. So we're very lucky to have him along as well today to dive into some of the technical detail of Approov. And then finally, I just want to mention that there is a special offer for attendees of this webinar, which I will reveal at the end. So please stay for that. That will be just after the questions, and it will definitely be worth staying for. So without any further chat, I will pass control over to Tiago. We're going to do this in three pieces. Tiago is going to set the scene, give us a bit of background into what MV is all about, and talk about the particular app that this project relates to. Then Skip's going to give us an overview of Approov and what it does, and then we'll come back and listen to Tiago telling us about his experiences with using Approov within the project and his plans for the future. So that's the running order, if you like. And with that, I'm going to hand over control to Tiago and ask him to introduce MV to us.
Okay. Hi, David. Hello, everyone. Thanks for having me. It's really a pleasure for us to be here. So as David said, I'm Tiago. I'm a software development manager and also the product manager of Medic MV app, which you're going to know a little bit more today. Okay, so MV is the largest healthcare IT provider in Latin America. We work on software development, and also as a healthcare management consulting services company. So we also have the best electronic medical record in Latin America, which was awarded for 6 consecutive years by CLAS, which is an important American research institute in healthcare IT. And we do not only provide solutions, but we leverage the digital transformation in healthcare institutions, providing the cutting edge technology. For example, in artificial intelligence, cloud computing, mobility, big data, interoperability, telemedicine, and other more important fields. Well, as David said before, we are based in Brazil. and provide solutions in 10 countries all over the Latin America and also in Africa.
What kind of size of company is MV, Tiago? I'm not sure I even know the answer to that question. I mean, how many people work in the company?
More than 1,500
wow.
people working at MV. Okay. In many offices over Brazil, every region we have an office. And we have, in more detail, we have 3 main development areas located in the northeast, south, and also the region of Rio de Janeiro in Brazil. Okay. And I'm going to present you the Medic MV. Medic MV is an app developed in partnership with Apple. We are part of Apple's mobility partnership program. And this is where our journey with Approov starts. It's an app for physician use, which brings agility to the doctors with no need to go to a computer to access their patient's information. It's all on their hands. This project started in December 2018 in Cupertino at Apple Design Lab, and we started the development in January 2019. And throughout the year of 2019, we started to collect information, involve the physicians, initialize the feedback loops, and validated our MVP and started some pilots in the middle of 2019, and our last customers in this pilot project we started on late 2020 last year, and we put officially the app to the market this year. And for you to know how it is fast and easy to deploy these applications. Since we have validated the app, we have released it from to all the physicians from a hospital. This is an example of one of our customers, and in only 3 weeks, we ramped from 40 to 450 users only in 3 weeks. So it has a really easy adoption, as it's very easy to use. We invest a lot in user experience and usability. I'm talking a little bit more about the Medic MV and the users. As I told you before, we started officially with the app to all the users of our pilots, and until now we have reached more than 2,000 users, so more than 2,000 physicians already using the app. These users are distributed in Latin America, but most of the users are in this moment here in Brazil. We are still working in new features. Some features are already delivered, so using the app, the physician is able to access the most important information about their patients, all their medical records with the relevant information. And until now, we just have positive feedbacks. This is the most relevant one when a physician, which is a neurosurgeon, has said that the app changed the care plan of a stroke patient. in resume, we can say that the information he had remotely from that patient saved his life. So it was very remarkable for us, and it was really remarkable for the physician himself. And I'm going to present you our team. We are a team composed of 10 people. The development team itself is composed from 6 people. We are a multidisciplinary and agile team, so we work very collaboratively and very close with the physicians. We have focus groups in all our customers where we are actively collecting feedbacks and improving our roadmap, improving all of the functionalities that we have. Sorry. And now I'm going to start talking to you how the Approov integration started and why it started, and the situation and how the app worked before and after we had the need to improve our security layer in the app. So basically, at the first moment when we released the first version of the app, we had basic security controls in the app with the iPhone technology, iOS technology itself. It's a robust and very reliable technology. All the communications were done by HTTPS protocol. And this is a representation where we have the app. The app communicates with a mobile server, which is a service from at cloud from our side, which works as a router, where the app consults for which hospital the physician is going to communicate. So at the customer side, we have an on-premise environment. The first point of contact is application services that we call MV Gateway, and this is the only point of contact of the app outside of the hospital, and it communicates directly with the API of the EMR. So all information from the EMR, which is our own EMR from MV, is executed by the gateway, and all information is provided to the app by the gateway. Okay, so so we have implemented it in the first pilot customer, and they, after about some months of using the app, they had a very important security incident in the hospital. So they have contracted a security information company to make pen testing in all applications of the app, and Medic MV was one of them. So they executed a very deep pen testing at this time. So we had security problems needed to be addressed at the time. So what we could do, we didn't have a large team to address it, and we would have to invest a lot of time. Fortunately, the security specialist from this company which was consulting our customer, talked to us about Approov and recommended us to see the solution. So this was what we have done. We reached Approov. We started talking to David and their team, and we found that it was a very suitable solution for the moment. So we could save a lot of time. I can tell you that at minimum, we had developed this security layer 10 times faster than we would have if we had developed it by ourselves. So I'm going to talk a little bit more about the process, but basically we have incorporated the SDK, the Approov SDK through the app, and the Approov security through all of our servers. You can note that the best implementation that we found was to put a reverse proxy as a primary point of contact inside the hospital network to increase the security in this operation. So we have the Approov protection on each node of the network. So every communication that flows over here is based on security provided by Approov solution, which Skip is going to get into detail right now. Please, Skip.
Thank you. David, are you going to control the slides?
I was going to give you the control of that.
Okay. Sounds good to me. All right.
Okay, you should be able to do it now.
Okay, thank you. All right, thank you very much for having me. I'll try and explain a little bit about how Approov works. But first I want to sort of go back a little bit in time. This is a slide from our friends at Cloudflare. Originally, most healthcare providers, hospitals, and many businesses were running their own sort of silos, their own castles, as you will, with their protections and with drawbridges and moats, and everything was done inside the castle. In wired connections, everything was controlled. That's definitely changed in the new world. People are accessing information inside the castle from wherever in the world they are, typically using APIs. They expect sort of instant, wonderful customer experiences. So the security world has definitely changed, and we are very active in protecting outside those castle walls. So I wanted to give you a little bit of information about how sort of a hacker in this new world goes about their job, and they do treat it as a job. I want to first, in the healthcare area, one thing that really surprised me was to find out that on the dark web, selling a medical record is 100 times more valuable than a credit card. And most of us hear about credit cards in the news, but medical records are very profitable for hackers. So there's a very active space. And a hacker will typically probe multiple sites, basically looking for weaknesses. He's trying to get his highest return on investment for hacking. What the hacker needs to do, where most information is being traded over APIs, is to make sure that he can mimic a realistic API call into those backends. He's typically going to be trying to steal user credentials and extract API keys. The user credentials are attempting to prove who is making a call, and he has to look like a legitimate user. And the API calls are trying to identify what is actually making the call. So in this case, say a mobile device, the developer will embed an API key in. It's just a secret held on to inside the device, and unfortunately, it's a fairly weak link in the security chain. Once the hacker has reversed engineered the API calls, has extracted the credentials he needs, then he or she can go ahead and just dive in and make a sequence of API calls to try and infiltrate as much protected healthcare information as possible and build up those medical records. Once they're in, they further can look at the API and use it in ways that the original app never intended. And they'll look specifically for vulnerabilities. For instance, if I can get in with one user's credentials and I get back an ID, can I just simply change the ID and see if I can find even more medical records of more patients that I can extract. So they will extract these healthcare records as quickly as they can. They will work fast, but stay under the radar of most of the back-end security solutions. And they will eventually just package up and sell all the PHI they can on the dark web. And as I said, medical records are 100 times worth credit cards. So this is a pretty booming industry. So as I said, Approov itself is working mostly outside the castle walls, outside the service. So everything between the user trying to present their credentials and the backend service, we're focused on first the integrity of the app itself. So if you've deployed a healthcare app, you need to prove that the app itself has not been tampered or modified, excuse me, modified in any way. And then secondly, you need to check the environment that the app is running in. So is the device healthy? Has the device been rooted? Are we actually not running on a device, but running on an emulator, for instance, or running in a debugger? Are there advanced sort of malware instrumentation frameworks that are trying to hook calls and extract information? So it's important to establish both that the app itself is the original authentic app and that it's running in a safe environment. And lastly, although you will use HTTPS, which encrypts the channel, or TLS, hackers, since they control the devices, are able to inject trust across this channel. And they can go ahead and man in the middle and observe all the API calls if you're not careful. So it's very important that you add some additional security on top of the existing HTTPS to make sure that those encrypted channels can't be breached. So this is basically how Approov works and how Approov was used in the MV application. You take an existing application that you're running and you drop in a Approov SDK onto the device. You integrate that in so that the Approov SDK is attesting that the app and the environment are correct. Once you have that integration set, then you register that with the Approov service so that the Approov service learns how to recognize an authentic app. You will then just send your app to the Pay Store. It'll get downloaded and used by customers. And when an app is making an API call, the SDK will actually call up to the Approov service, which is running in the cloud, and say, would you please attest that I am healthy and okay to make API calls? Approov will then request some information from the app in a very cryptographically secure and randomized way. And it will make an assessment as to whether it's appropriate for this device to go ahead and be allowed to make API calls successfully. So it will verify that the app is authentic, untampered with, running in a safe environment. And if that's true, then Approov will send a token to the application, which it will then add to the API calls. So it will then make an API call to the back end. And when that happens, the token that is sent will be evaluated by the backend service. And it will say, is this token valid? Has it been signed by a secret that our service knows, as well as your backend data service knows? If it has been signed correctly and it has not expired, then you know that what is making the API call is an authentic app running in a safe environment. If it turned out that the app was in some way tampered, when it requested to the Approov service for attestation, the service would still issue it a token. So as far as the app knows, nothing is unusual, but the token in this case would be not properly signed. So when the app attempted to make API calls, then the backend would recognize an invalid token and therefore know that whatever is calling it is not the authentic safe app. And that's the primary mechanism that Approov uses to make sure that you are secure in knowing what is calling is the actual legitimate app itself. So now I'm going to switch to an Approov demo. So David, can you give me control of the screen? Okay. I still don't think I have control of the screen. Okay, got it now. Thank you. So let me switch to this. Okay, so you should be able now, oops, excuse me, just one sec. Okay, you should now be able to see pretty much a white screen. This is just a browser window that will show an animation of how Approov works. So we have here a simple Shapes app I'm going to launch. So imagine that this is the application you're trying to secure. It's simply calling over to a backend service through the cloud, which is showing some random shapes that are being fetched periodically here. So if you're a fraudster, as I said, going through the steps, the first thing you're going to try and do is part of your attack is to steal API keys. You'll typically do that either by analyzing the app and see, can I find the secrets that's buried in the app? That's unfortunately surprisingly easy to do. If you find that too difficult, then your second option, as I said, you have a weak TLS connection, so you can go ahead and try and extract that API key by placing yourself in the middle between the app and the service. So once you have that key, then you can go ahead and start making API calls. You might initially start quietly, and you will ramp up and put more and more of your resources into extracting information by using the same API that the app is. So when you add Approov into your service, the first thing you will do is integrate that in. So drop the SDK into the app. Now the app will be communicating to the blue Approov service here. But as far as Approov knows, it knows nothing of this app. So it's sending back these red tokens that are invalid tokens because we haven't taught Approov how to recognize a valid app. So the last step that you need to do when you're deploying your app is to go ahead and register the app with Approov. So now every time the Shapes wants to make an API call, it's looking to the Approov service for a token. It's now getting a valid token. So your backend can now recognize that this API call is valid. We haven't actually checked the tokens in the backend yet, so the fraudsters are still able to make API calls. But as soon as you go into your backend service, and as Tiago mentioned, using a reverse proxy, for example, you can enable the Approov checking. And you can see we've now disabled all the bots making API calls with no tokens in this case, or with invalid tokens if they could find some. And the Approov service is still being recognized as having a authentic app and therefore a valid token that's going through. So I'm going to stop sharing here. And David, if you can take back over the screen. Okay.
You should have control now, Skip.
Thank you. Okay, so one of the things that I mentioned is that the Approov service, which is making the decision as to whether it is safe to make an API call or not, is running in the cloud and has a very secure link into each individual instance running. So this allows us to do a number of things, one of which is to collect metrics on the fly of everything that's happening. So what you're observing here is an actual, in this case, a financial application for payment transfers, and it's quite popular. There's about 40K kind of transactions going on per minute here in this application. And you can see there's a sort of a steady attempt to attack in this. These are all failed attestations, and these are running on the order of around 25 per minute. So there's attacks going on here. This is a list of all the different ways that attackers are trying to get in, whether it's using rooted devices, cloned applications, running in emulators, instrumentation frameworks, all sorts of bad things going on here. And so your applications, and excuse me, I think you'll find for healthcare applications, you will always have probes and people attempting to see, can we get in, can we breach the service, studying your APIs, whatever information they can get. So you will always expect to see this malicious traffic. The idea using Approov is to making sure that that can never successfully even get close to the castle. It can't make a successful API call. We also use this channel for other things. We can use it for forensics when we have to go back and look at situations that have happened. We can also add and upgrade certain security features through here. And perhaps quietly and most importantly, we use this channel to pin connections. So this is the primary mechanism we use to strengthen the TLS connection between app and backend service. So we work in many spaces, not just the healthcare space. This is a quote from Popper, which is a large Turkish financial payments app. And it just is describing how once they implemented Approov, which took about a month, as soon as they turned it on, they were able to cut the malicious traffic by about 90%. Financial apps, the main payments app use case is preventing money laundering. So there's quite an active fraud trying to go through with money laundering, and they were almost able to 100% eliminate it as soon as they turned on Approov there. So I think with that, I am ready to turn back over to Tiago.
Yeah, sorry. Yeah, thank you very much, Skip. I'm going to tell you a little bit more about how we have developed this integration. It was a kind of simple activity for us. We made it in a matter of a week since the beginning, where we have studied all Approov documentation with all support of Approov. And the beginning of the first week, we have understood what we should have to do and start the development. And in about more 1.5 weeks, we have finished this integration, and we took 1 week more to have everything implemented on our first customers. It was quite easy, and we had additionally, I can tell you that we have a kind of a different situation on our product deployment, as we had on-premise application. We counted on customization on Approov SDK to permit the validation of multiple points from our customer side, since we don't have a single application being consumed for all of our customers. So I think Approov SDK now can handle any kind of deployment of application that exists. And it was very clear with Skip's presentations that smartphones are subject to, for example, reverse engineer, and also the TLS protection is not so strong as it appears. Developers have to take care while developing new applications, especially in the healthcare field. So the traditional way of development and deployment is very risky. And you know, we could see that, especially in a man-in-the-middle attack, it's very easy to do, surprisingly, for expert people. So, especially in the healthcare field, we have to be very aware of it. And in most advanced countries in regulation and privacy issues, there is a specific law to minimize the impact of information stealing and disclosure. And here in Brazil, we are experiencing a new era in this subject of privacy. Last year, in the middle of last year, we started our own privacy regulation law, which is LGDP. translating it, it's General Personal Data Protection Law. And in the middle of this year, Brazil's government is going to start to enforce penalties for the institutions that are not complying with this law. And we also work in a highly regulated industry, which is healthcare. We work, as Skip said, with protected health information, which is one of the most valuable information in the world. And it's something that we have to have real concerns about, to take care of the security of the applications that we deliver for our customers, especially in this moment. And here at MV, we already have implemented the Approov security in MedCMV. It was a very good experience, and we are planning to implement it in all of our apps, starting from the apps which have external access outside of the hospitals, and hopefully, if in the future Approov can help us in our web application, it would be very good, because not only the apps must be protected, but all kind of the applications. So I think we finish here. Thank you very much. I give the control back to David.
Oops. Thanks, Tiago, and that was really interesting. So, what other kinds of apps do you have? I mean, you've got the physician app there, but do you have apps for patients, or is it for other services within hospitals?
Yes, we have a suite of apps. Most of them are only for internal use of the hospitals. We have physicians for the nurses, physicians for the process of surgery, and many administrative tasks in the hospitals. Those ones are examples of situation that we provide mobile solutions, which they use are only inside of the hospitals. But we have another application that is a personal health record, which is used by the patients.
Mm-hmm. Okay, interesting. I can reveal on the web thing, and maybe you don't know about this yet, but we have the next release of Approov coming out in next month is going to have. I'm not going to reveal exactly what, because it should all come out in time, but I think there'll be some news in that with respect to web that will make life potentially easier for you moving forward. So let's just leave it at that, and keep an eye on what we're doing, and I'm sure we'll make plenty of announcements around that release date for the next release.
Great news, David.
Yeah.
The healthcare field. Thank you for that.
Yeah, it's we'll talk a little bit more later after the Q&A about what we're doing in healthcare, but. And obviously, if anybody has questions, please put them in the chat, and we will do our best to answer them. So first of all, we've got a question here about TLS. So Skip, maybe you want to take this. So there's a question: does the app need to have TLS implemented in order to make use of Approov?
So I guess technically the answer would be no. However, I think that Apple and Google work very hard to attempt to require you to use TLS, and I really think that you should be using it if at all possible. The danger with not using TLS is then it is very easy for an attacker to get between you and the backend service, so between your app and the service. And in that case, it's trivial to read the traffic, since the traffic won't be encrypted, extract any PHI information, extract credentials. The bar is way too low for hackers in that. So I would strongly discourage anyone from doing that. And as I said, I don't think the app providers encourage that as well.
Okay. Good. Actually, this question for me is really to do with the whole pandemic situation. I mean, when you look at that now, we obviously sometimes we have a hard job remembering back to the time before we were in the middle of a pandemic. But and I'm sure it's obvious that it has had a significant effect on healthcare as well as many other sectors. But I mean, for MV, Tiago, what kind of impact has it had on the services that you provide or your plans for the services? Just curious as to how it's changed the world compared to what you thought you would be doing by this time.
Sure. I can give you an overview. We had more negative impacts than positive impacts. Now, talking first about the positive impacts, we had a boom of telemedicine solutions in all the market. So we were already working on a telemedicine solution. So we had launched it in the middle of the pandemic. It was good for the business. The Medicap itself is a great tool in this moment because the physician don't have to use shared computers, so it can minimize the risk of infection inside of the hospital. So they can use and they must use their own iPhone or iPad. But we had negative impacts also. Many projects, implementation projects were canceled by some hospitals or suspended. Hospitals, most hospitals that don't treat urgent or are not hospitals, are clinics or outpatient clinics, for example. And many hospitals suffered from the lack of surgeries that was not urgent. And since the surgical center is one of the most profitable department in the hospitals, the hospitals got with no money, some of them, and it had impact on the payment. So we have to have a workaround for not suspending, for example, services. We have not suspended services from the hospital. We can't do that, but we even could decrease the services in the customers due to this pandemic. We understand all the situation, and we are here to help all of our customers in this moment.
Yep.
And directly related to our support department, there was an increase of the work we do here. Many hospitals got with many people. The beds were not sufficient to admit so many patients. If you count the number of patients that already went to the hospital plus the number of patients with COVID-19, which need specialized attention. The hospitals didn't support. And right now we are in a situation that all hospitals are over capacity over here. So they need more attention for our support department. And also they need some new features to be implemented. For example, we have the obligation here to communicate notificate the government for some diseases, and COVID-19 was marked as one of these diseases, and we have to make enhancements in the system to provide this rapid communication to the government in a standardized way, and not just in the diagnosis notifications, but the exam results and vaccination information also.
Yeah. Well, it's of course the frontline medical workers, their efforts are of course much appreciated, but it's obvious that companies like MV are providing the infrastructure and making sure it keeps running, and they have the technology and the features that they need, and I'm sure that's very much appreciated as well.
Yes, and we also offered many of our solutions, especially the SOMV, which is our hospital information systems for free for the campaign hospitals, which was created during the first phase of the pandemics over here.
Yeah, no, that's great. Okay, another question here about the environmental checks that Approov does. So the question is, if maybe not in healthcare, I suppose, but in other markets, if you wanted to allow apps running on rooted phones, or, well, I don't know, that's the example that's given, but rooted phones, is that something that can be supported, or is that detected and rejected?
Good question. I did sort of skim over that. The way Approov works is it will detect everything that is occurring, but the customer of Approov is able to establish a security policy that works for them. So if you are in the healthcare industry, you might want to disallow rooted phones or rooted phones or applications that are running on emulators, for example, believing that those are not legitimate, and you want to keep your security high. If you are protecting a game, gamers really like to mod their phones, so you may choose to go ahead and allow rooted phones in that case. So the rooting would be detected, but it would still issue a valid token if your security policy was set that way. And as I was mentioning, there's an external link that we have to all the instances running. So it means that you can launch your application with one security policy and perhaps tighten it up or change it over time. The classic case is if we're working with a retailer, they're very concerned about not losing customers. So they typically will launch with phones allowed to be rooted. And then if they detect some sort of breach, they may choose to tighten their security policy. So they may choose then to disallow rooted phones. And basically what they do is they change their security policy, and within 5 minutes, all the active devices will be now running with the new security policy with no change to the application, no need to install a new application. It's just taken care of instantly.
All right, great. So in the minutes remaining, I just want to go through another couple of things. Just talk a little bit about what we're doing in mobile healthcare. And some of you may be already aware of the fact that we we sponsored some research into the state of mobile healthcare. This was done in really the second half of last year, and we worked with Alyssa Knight, who's a very well-known ethical hacker and great person, and she did her own research into 30 mobile healthcare apps and their APIs, and looked at the standard of security. And it wasn't very impressive, which is maybe not that surprising. But more constructively, it looks at what things need to be done, and actually it got quite a lot of coverage in there. The report itself, both within journals like Forbes, but also even reached as far as reports of what's going on within the US federal government because of the push towards healthcare records being available through open APIs later on this year. So we're continuing to do work in this area. And if you want the report that's already been done, there's a link there, and actually Tiago's put it in the chat as well. So if you want to download that report, you can do so if you haven't already seen it. But we're continuing to work with Alyssa, and she is currently working on an additional activity looking at the security level of FHIR itself, FHIR APIs themselves. What we suspect is that the kind of default position with respect to FHIR APIs and security is probably not high enough. So there will be things that people who are offering and deploying FHIR APIs need to do over and above the base standard, but that will come out of the report. We expect that to be available in the next 4 or 6 weeks. So there's a trailer into the work that she's doing, which you can see in that link, and feel free to stay connected with her, and the report will become available when she's finished doing her work. So we're very committed to healthcare. We understand that, of course, a lot of mobile services have been deployed quickly for very, very good reasons during these difficult times. And so it's understandable that security might not have been as strong as it could have been. But now is the time to go back and get that fixed. And we're certainly doing as much as we can to help companies in the sector get their security to the level that it should be at. So finally, this is the special offer. So for those of you that have stayed until the end, well done. Here's your reward. We obviously already offer for anyone a free trial for 30 days, but in addition to that, we will do something that we normally charge for, which is a pre-deployment checklist review, where you get to spend time with somebody like Skip and go through your implementation and your policies, get everything checked off. This will be based on our experience of other customers going live, kind of typical misunderstandings perhaps, or strategies that you should use to get your platform pen tested, troubleshooting issues, things you might have forgotten about, etc. So using our experience and our expertise to make sure that your deployment is as clean as possible. So the first 5 people who sign up to the free trial will be able to get that additional pre-deployment checklist review free of charge. And when you sign up to a trial, the last page you fill in has got something on it which says any other information. So if you just put in MV webinar into that, then that will trigger that additional piece. And there's a link to where you sign up. So I think we're just about out of time. Actually, we're a little bit early, but that's not a bad thing to do. So I will thank Tiago very much for his time and the work that he clearly put into explaining the project to everyone today. And thanks Skip as well for his continued excellent work for Approov. And thank you again to everyone. And that's it from us.
Thank you very much, David. We had a message here from Professor Renato Sabatini, congratulating us. Thank you for attending, Professor Sabatini. Professor Sabatini is one of the world's biggest authority in healthcare information, healthcare information technology and digital health, and especially in health information security. So thank you very much for your presence. Hope you could understand better the situation that we have in terms of lack of security.
Great. Thanks, Tiago. Thanks, everyone else. We're going to sign off now. So thanks again for attending.